What I wish I would have known before I got immediate dentures. Patient perspective. So bone spurs. Bone spurs are pretty common with immediate dentures. Bone spurs or slivers of teeth can come out of the gums, work themselves out, and are very painful and discomfort, often pinch the tissues against the denture, but they're very common. Call your dental provider and arrange to get those out right away so you can get some relief. Bleeding. You're definitely going to have some bleeding after you have your teeth extracted. A moderate amount of bleeding is totally normal. If there's excessive bleeding that you're concerned about, go ahead and let your provider know, but bleeding is totally normal. The important thing is do not try to really clear your mouth too vigorously of the blood and the saliva that gather in your mouth, because you don't want to create that back suction on those sockets. You want to keep those blood clots intact in those sockets to help your body to heal. So when you rinse your mouth, go ahead and just rinse gently, rolling it around your mouth, no vigorous swishing, just like this. Bend over the sink, let the water come out, and that's it. Don't do it too many times a day. You do not want to dislodge those blood clots. Bruising. Bruising is fairly common. Some of my patients get it pretty bad. Some of them don't get it at all. Usually you get it down in here, on the bottom of the jawbone, on the chin, sometimes down below the neck, and sometimes I even get patients with black eyes. Something that's very normal, especially if you have a tendency to bruise easily. Sometimes age makes that also something that's prevalent. Totally normal. Salivation. You're definitely going to have some increase in salivation when you have new dentures or immediate dentures, because your body thinks that there is something to digest. That'll calm down after about 2 weeks, but saliva is good. When you have dry mouth, dentures are harder to wear. Gagging. Gagging is definitely an issue that sometimes presents, especially with new dentures and immediate denture patients. Sometimes this can be mitigated with small adjustments to the length of the palate or the thickness of the palate. Some patients have a harder time gagging than others, and we have to shorten the palate a little bit more so than normal. Get with your provider. Usually they are very well versed in this. Looseness. Loose dentures, when you get an immediate denture, is very common, and they will progressively get looser. We do make them purposely a bit loose because you have big undercuts when you first have your teeth pulled out. Your gums were very big when you had your natural teeth, and so they have undercuts, meaning they kind of go up and then dip in. So when we make the denture, we don't want you to scrape on those undercuts, so we do create a little bit of extra space to accommodate these areas, at least for you to heal. And also you have swelling. That first 72 hours especially, the swelling is on the uptick, so we want to make plenty of room for that swelling in there. Looseness is something that we're going to address at the 7 to 10 day appointment in my office. That's how I do it. We do a temporary reline, and that is when we go and put a little bit of material in the dentures, place them in the mouth, and do a temporary reline. It's about a 15-minute appointment. That's your first breath of fresh air. Your bite. This is something to be really cognizant of. When you get immediate dentures, you are getting your bite captured when you still have your natural teeth in your mouth. So when we're having you bite together, you may have loose teeth. You may have lost your true bite along the way when you developed crooked teeth or malocclusion, infections, whatever. So there are times, and it's not super often, but there are times when the bite is a little bit off because the patient's bite is just not on when we're doing the bite when they still have their teeth. So when you have an immediate denture, if your bite is off, sometimes that can be corrected when the swelling goes down. Sometimes it improves, but sometimes the bite is just off, and it's nobody's fault. It's just something that happens. It's something that we just have to deal with, and that's where you would make the decision. Do I want to reline this existing immediate denture at 6 months and make this my permanent denture, or do I want to go ahead and purchase a new denture at that time and start all over again? Obviously, the benefits of getting the new denture at 6 months is that you are starting from scratch. You are getting brand new impressions after 6 months when your tissues are completely stable. Also, you get to have a wax try-in, which is amazing because you get to preview the teeth, make sure that you love how they look, and we get to preview the teeth and make sure that the bite is perfect, make sure that everything is perfect before we process it. So hopefully that's some good information for you. Please like and follow me. I'm really enjoying doing this and I need more followers. Take care.